Hi, my name is Professor Kuntal Patel and I'm a Consultant Orthopaedic Surgeon in the North Western UK, and I practice in hospitals in Lancaster, Blackpool, Preston and Blackburn. Today we're going to talk about partial knee replacement. First of all, let's discuss what is a partial knee replacement. So as the name sounds, partial means a part of your knee is replaced. And essentially, in very simple terms, a knee has three compartments. The inner side, which is medial, the lateral side, which is the outer side, which is lateral compartment, and behind the kneecap, which is patellofemoral compartment. So if we are able to replace just one part of this joint or two parts, very rarely, then essentially it's classed as a partial knee replacement. The commonest part of your knee to wear out is the medial side or the inner side of the joint, and hence one of the common partial knee replacements performed is a medial unicompartmental knee replacement. Well, let's discuss next what is the difference between partial and a total knee replacement. Total knee replacement, as the name sounds, is the replacement of all of your knee joint. So essentially, you have a big cap on the femur, a big tray on the whole of the tibia, and you have a plastic in the middle. And that is a standard type of a total knee replacement. Whereas with partial, as we discussed, we are only replacing hopefully a third of your joint, which is your medial compartment, and very occasionally we replace any other parts associated with it, which is called as a medial unicompartmental with maybe patellofemoral resurfacing, but those need to be discussed specifically with you. Are there any advantages in considering a partial knee replacement compared to a total knee replacement? Well, let's discuss those. So partial knee replacement generally is less invasive than a full knee replacement. It generally gives you a quicker recovery thereby and quicker return to work and back to your day-to-day activities in life. In the long term, the survivorship on an average is around 8 to 10 years. That's based on the national database. But for you as an individual, that could be slightly less or more depending on the individual case. The other advantage is functionally, patients following partial knee replacement do a lot better than a total knee replacement, and this has been proven with scoring systems. And often patients tell me that it feels more like your original knee, but with less pain and return to function. Are there any disadvantages then in considering a partial knee replacement? As I mentioned before, the average survivorship is 8 to 10 years. And that can potentially be a disadvantage compared to a total knee replacement, which typically can last you 15 to 20 years. So therefore, in my hands, what I tend to do is look at the age of the patient, the functional demands, and the type of arthritis or the extent of arthritis you have. And based on that, I can advise my patients whether a partial or a full knee replacement is best suited for them. So for example, when I see physiologically young, active patients who still play a lot of sports, etc., if there is localized arthritis, typically in the medial compartment of the joint, partial knee replacement works well for them. We're starting with lesser surgery, and then later on in the life, if and when you need a full knee replacement, that then gives you another few years and takes you to the rest of your life. Let's talk about a couple of interesting facts about partial or total knee replacement. I often get asked by patients, can you return to sports after this? And the short answer is yes. Most patients can return back to things like cycling, tennis, racket sports, even skiing, running, etc. But this has to be used judiciously, and I tend to discuss that on individual needs. And then the second common question I get asked is about driving, because that is a very important part of your day-to-day life and to maintain your independence. When can I return to driving? The short answer is typically around 6 weeks for a total knee replacement and around 3 to 4 weeks following a partial knee replacement. But again, if it's a left-sided surgery and if it's an automatic car, I often see that in my practice, patients are able to return to driving maybe a week or two, even sooner than that. So in summary, a partial knee replacement is a good treatment option for patients with advanced arthritis, but localized to 1 or 2 compartments, and it gives good functional outcome. Thank you.